Hello everyone. So today I'm going to answer the question of how specifically we age and how aging actually affects the appearance of our face. Now, I wanted to answer this question because I had a recent discussion with a patient who was concerned about her nasolabial folds. So nasolabial folds are these lines that go between your cheek and along the edges of your nose. They do become more obvious with time as we age. And I do get questions and requests from many patients on dealing with them. I want to address this by talking about how nasolabial folds get formed, how they become more obvious, and what we actually do to fix them. So nasolabial folds become more obvious with time because we start losing support along the bone of our cheeks. So as this bone loses volume as we age over the course of our 20s and our 30s, the tissue, the skin, the muscles, the fat pads that are typically supported by this bone, they start to sag forward and inward. Now, if you imagine as they sag inward and forward, the folds, the lines between your cheek and your nose and your lips, they become more obvious. And that's why over time you start to notice these folds. When we treat them, we can definitely treat them with fillers. However, we don't inject the fillers into the folds themselves. What we do with fillers is we actually address the reason why these folds are more obvious, which is the loss of bone volume along the cheeks. So when I treat nasolabial folds, I always talk to patients about replacing volume along their cheeks first, and also along the lower half of their cheek to lift up their skin, to kind of bring it back to the position it once was to help decrease the appearance of these folds.